North Texas heat is tough on everyone, but it can be difficult for kids to really realize when they've spent just too much time outside or even put themselves in danger developing a heat illness. Dr. Troy Smurawa joins us this morning. He's the director of pediatric sports medicine at Children's Health Andrews Institute for Orthopedics and Sports Medicine. Good morning to you, doctor.
Good morning, Cleo. Thank you for having me here this morning.
Glad to have you as well. This is a big topic right now because we've been dealing with some triple-digit days. And first, what do you do at the Institute?
Well, I'm a sports medicine physician, so I work with a group of physicians that deal with young adults and children as far as their sports injuries and sports activities that they involved in.
All right, let's talk about, I guess, the heat illness. Are children really at greater risk?
Well, I think children are at greater risk for a couple of reasons. I think children, they're exercising outside or doing things outside, and they may not be aware of the heat and that their body is actually getting hot inside.
And I guess which kind of children are at greater risk?
So children that we see that are at greater risk are those that may have chronic illnesses such as diabetes or asthma.
Okay.
We also know that kids that are on certain medications, that may put them at a higher risk for heat illness or heat stroke, as we're concerned about.
Right.
Also, kids that are overweight or may not be in shape or acclimated to the environment also are at a higher risk for heat stroke or heat illness.
And those that may be sick, like you said. So there's heat exhaustion and then there's heat stroke. What is the difference?
The main difference between heat exhaustion and heat stroke has to do with the level of core body temperature. So as the core body temperature rises, the body cannot adapt to the heat. And heat exhaustion basically means your body's getting hot, you start to get tired, fatigued, dizzy, disoriented. But as the temperature rises dangerously to 104 or higher, then we call it heat stroke. And heat stroke is a life-threatening emergency. That's when the body's core temperature goes so high that they're unable to regulate their body temperature. And then they start having effects on their brain and the rest of their body.
You know, it's summertime. I see children outside all the time riding their bikes and playing by the lake. They're having fun. But I guess what are the signs that we need to look out for when it comes to heat illnesses?
I think there are some good warning signs that we can see that kids will develop. They'll start to get really fatigued, they'll hot, they'll get dizzy, lightheaded. They may have a headache. May often feel nauseous, and they often sometimes vomit when they start to get heat illness.
And I guess what are the signs of heat stroke?
Heat stroke is where it really becomes an effect on the body's organs, especially the brain. So they'll actually get really disoriented. They'll be confused. They may actually pass out. And actually, if it gets really serious, they could have a seizure. So it's a serious life-threatening condition that can occur in anyone.
It really is. So we're talking about the signs and symptoms, but how can we prevent this?
Well, prevention is the key. I think the important thing is for parents to know that heat illness and heat stroke can occur in anyone. And it can happen even when the temperatures are in the 90s. It doesn't have to be up in the triple digits. Things that we look out for, things we can do to prevent it, are making sure that your children are exercising or outside during the cooler times of the day. They really should avoid the heat of the middle of the day. I think also it's important to make sure they're staying hydrated, because kids that are dehydrated are at a higher risk of getting heat illnesses.
Oh, great tips there. Thank you so much for joining us so early in the morning here.
Well, thank you for having me. I appreciate it.
Of course, and we'll be sure to get this information on our website at WFAA.com. Thanks, Doc. Thanks for joining us here.
Thank you.